Awesome.
Great.
Normally it's 8:33, so Dr. Stan, we're going to get started just
Great.
because I don't want us to miss anything.
Absolutely.
I just want to say welcome everyone to the Health Hub with Dr. T. I'm Dr. T. Thank you so much for joining this Tuesday.
Mhm.
Typically, we do a Monday, but today we're doing Tuesday because of the holiday, and it worked out perfectly with Dr. Stan's schedule. So, thank you so much, everyone, for joining. As usual, I give a disclaimer. Everything you hear on this page, on this live, is general information only. So this isn't, Dr. Stan is going to answer some questions, but anything specifically related to your health or a loved one, we're going to refer you back to your doctor or go call Dr. Stanley. Okay. And he can definitely answer one on one because he would do all the typical things that is needed. So again, I just wanted to give that disclaimer. Thank you so much, Dr. Stan. Can I call you Dr. Stan?
Absolutely.
Okay, I'm going to
Let's
call
stay
you
back.
Dr. Stan.
Go
I
for it.
typically don't do this, but I'm going to do it tonight.
Okay.
I'm going to do a little, I guess, reel after this about your circle and how people in your circle can they propel you forward. And I say that to say how I met you. Because yesterday, just us getting on the live to make sure that it works out well was our first time speaking, was our first time even seeing each other, right? I mean,
True.
I've seen you
True.
on social media, I've stalked your page, so I know what you look like.
That's awesome. Great.
That was our first time talking. And I think it was based on a really good friend of mine's 40th, Elizabeth, where I met your amazing wife. And I've
Mhm.
kind of seen your sister here and there. And
Yeah.
I reached out to both and I was like, please, I need to get Dr. Stan on the Health Hub.
Okay.
And I didn't even have to beg. They were like, let me talk to him.
Mhm.
So the power of who you know, I'm going to get into that after that. So I
Okay.
don't want to take up too much of your time on that. But I
Mhm.
would love for you to just introduce yourself, tell us
Mhm.
a little bit about, how where you're at practice wise, a little
Mhm.
bit of your background, and then we'll get
Yeah.
right to it.
Absolutely. So thank you, Dr. T, for inviting me. Yes, like you said, it took a little bit to get this organized, but I'm glad that we're able to get it going. So I'm sure it's going to be beneficial to everyone watching and hopefully to myself and you as well. So a little bit of a background. So Dr. Stan, as everyone calls me, Stanley Ogu. My last name is Ogu. And I'm a plastic surgeon, a cosmetic and reconstructive surgeon. I've been in practice since 2018 when I completed my training. I went to medical school in Nigeria, eventually came over to the US. I'm a double board certified plastic and reconstructive surgeon, which means I did two separate kinds of training and got board certified in both of them. And so that's just a little bit of a background. Currently, my practice is located in Sugar Land, Texas, which is a suburb of Houston. And I'm saying this because I do have about a third of my followers and patients who come from out of town. And a lot of
Wow.
times they're like, oh, where's Sugar Land? So it's a suburb of Houston, Texas. And so that's where my practice is located. I have, like I said, about two-thirds of my patients locally from within Texas. I know one third of them come from outside of Texas and also outside of the United States from Canada, United Kingdom.
Wow.
I actually have a lot of patients from Nigeria as well.
Wow.
So yeah, please ask whatever questions
Ooh.
that you might have.
All right, let's get right into it. So, I want to give a little background, right, as to why I wanted plastic surgeon. I think even when we spoke, you were like, "What you got to ask me? Like, why am I coming on the Health Hub?" And I was like, well, there's first of all a lot of taboo about plastic surgery, right?
Mhm.
Because no one, I think aside from the Kardashians, that's when I really started understanding plastic surgery. No one talks about it. Yet I have friends, lots of friends that have had some sort of plastic surgery, whether it's BBL, whether it's a tummy tuck, whatever the case may be, no one talks about it. So I
Yeah.
said, well, you know what? Because no one talks about it, we're going to talk about it. And
Yeah.
because I feel a lot of people are getting it and they're not well educated on how to get it, where to go. They're just kind of following people on Instagram and saying, oh, I think I heard about doing this in Mexico, so I'm going to do it. So I wanted someone that was based here, someone that can talk about the risk, someone that can talk about who's a candidate, what are the steps that you take into taking on a patient. So I'm going to start with this. Is
Mhm.
there a difference between cosmetic surgery and plastic surgery?
So before I answer that, I want to quickly allude to something that you said. There's a lot of people getting plastic surgery, and they're not talking about it. But I've seen a shift in that sort of like mindset and opinion from when I started practicing up until now. I think it's been more of a generational thing, and the younger generation are very open about what they do
Mm,
and they share. And with the advent and the growth of social media and plastic surgeons and plastic surgery pages, I think there's a lot more conversation and discussion being had about plastic surgery. So it's no longer as taboo as it used to be, especially
right.
amongst the younger generation. And directly to your question, what's the difference between cosmetic surgery and plastic surgery? For a lot of people, they see both things as interchangeable, as one and the same,
Mhm.
but that's not necessarily the case. Plastic surgery is a wide umbrella that encompasses various subspecialties. And so you can be a plastic surgeon and you can be focused on reconstructive surgery, on burn
Mm.
surgery, on aesthetic or cosmetic surgery. So you can do so many other things, right? So cosmetic surgery is just one arm under that umbrella, one stripe under that umbrella. And so they're not necessarily the same thing.
Oh,
Yeah.
okay. Because, you're right. Coming out, everything is kind of used interchangeably. So it's almost like, oh, I'm going to go get surgery. And someone's like, oh, that's cosmetic surgery, but
Yeah.
maybe it's another type of surgery. Hmm.
Right.
Okay.
So cosmetic surgery is just like a sub part of plastic surgery. Like I said, you can be a reconstructive surgeon, a burn surgeon, a pediatric craniofacial surgeon. All of those are regarded as plastic surgeons. But because colloquially, when we're talking about plastic surgery, most people talk about what they see and what they hear about the most, which is
Right.
usually cosmetic or aesthetic surgery.
Ah, okay. Thank you for that. Thank you. So
Yeah.
let's go to your specialty,
Okay.
right? Because you specialize in, I mean, even I think yesterday you posted some pictures, and
Okay.
I was like, okay, Dr. Stan,
There were
you know,
reposts. Put it
you would
that.
okay, you would reposted some
Reposts.
pictures, and I was
Right.
like,
Right.
okay, so you do a lot of BBLs,
Yes,
you
yes.
do a lot
So
of tummy tucks.
right. And all those are considered part of cosmetic surgery. So just like we
Okay.
said, cosmetic surgery is part of plastic surgery. Cosmetic
Hmm.
surgery encompasses a whole bunch of procedures, including, like you mentioned, BBL, liposuction, tummy tuck, breast lift, breast augmentation, all of that. So that is my specialty. 99.9% of what I do is cosmetic surgery. And
Okay.
so, yes, you're correct. What you said, that's mostly what I do.
Okay. So cosmetic surgery, so someone coming to have cosmetic surgery, could they have it because of health issues, or is it always, I hate to say it like this, vanity? Like, are they just coming because
So
they look good, or could it be I'm doing cosmetic because of this?
So neither of those is
Okay.
correct. So you're not doing cosmetic surgery mainly because of health reasons. It's mostly elective, which means that if you don't get it done a certain time, a certain day, you're not going to suffer any health consequences, right? However, it's also not considered vanity because vanity is such a broad swipe at what people at their motivations for pursuing cosmetic surgery. For some people, they just want to feel better about how they look. For some people, they want to feel better. They feel good on the inside, but the outside doesn't match that. And for a lot of
Mm,
people, it's like, when they look at themselves or they look at your pictures or something, it makes them feel a certain kind of way and
yeah.
want to start feeling that way. So they want to find, and there's a way that you can safely make them feel and look better about themselves, and why not do it? So I would not consider it vanity, and I wouldn't tell you that it's being done for health reasons. Now, the other thing that I will say is that I've seen a lot of patients who, prior to having the cosmetic surgery, plastic surgery, they were not as motivated to take care of themselves health wise. So they do it, they start to look good. They
Yes.
look at those pictures, the selfies, and they look at their pre-op pictures and they're like, I never want to look like that again. And then I
Right.
always tell everyone that, I can only do so much for you with the surgery, but at
Hmm.
some point you're gonna have to do the heavy lifting when it comes to the maintenance of your results long term. You're welcome to come back to me to do it again, but I have to be honest with you and say you can take care of these results yourself and make sure that you don't gain the weight again or do go into the bad habits that probably got you to this point. And so, in a way, it motivates people to actually live a healthier
Yeah.
lifestyle. Yeah,
Because yeah, if I look good, I mean, well, if I feel good, I want to look good. And
yeah,
then when I start getting compliments from people like, "Oh, girl, your body was body," oh, I'm like, I want to keep that up, right?
yeah,
Okay,
absolutely.
you touching on a lot of things, Dr. Stan. I don't
Yeah,
know how I'm gonna do this. I don't know how I'm
so
gonna do
go
it. Let's
ahead.
go to safety because you talked
Okay,
about safety.
yeah, absolutely.
Before, and I think I was part of those naive people where I think I thought it was better outside. So I've personally never had surgery or cosmetic surgery, or plastic surgery. I'm not opposed to it. Me personally, I would love to be informed about it to make the best decision for myself.
Yeah,
But when it comes to safety wise, before, and correct me if I'm wrong, before people were more migrating outside internationally for the things that you do. What are the risks of going outside the country to do such a procedure? Like, let's talk about the surgery, this procedure, like the BBL. What does
yes.
that entail when someone comes into your office and say, "I want a BBL"? Is it just like, great, I'm gonna draw on your body, you're gonna look good like this. We going in 4 hours. We done. Have a good life. What
No,
does that? What does that?
it's
Take me
not.
through that process.
So it's not that simple. So first of all, we can talk about safety in plastic or cosmetic surgery for the whole hour. Okay, but we're not going to do that. So I'm going to try to distill this down to like very, very specific points. So for me, safety is the most important thing. Like I said, cosmetic surgery is an elective, procedure that you get in. It's not something that's going to save your life, or you're threatened by some disease or something if you don't get it done. So for every patient who walks in through the doors of my office, the first thing that we're trying to assess is your medical history. Do you have any things that might preclude you from getting this procedure that you're trying to get? And sometimes you might be healthy, but you might be trying to do too much at one time.
Mm.
And so it's my duty, it's my role, my job as your surgeon to, advise you and say, hey, we can only do XYZ within safe
Right.
limits. And so, you talked about when people go outside the country. I think there are great surgeons all over the world, and I
Right.
say that because I've done a bit of traveling myself. I've been to Latin America, been to other countries to see how things are done, and so it's not so much to say that there are no great surgeons outside of the United States. No, but one thing that I see as a big difference between how we do things here and other parts of the world is that we have very, very stringent safety standards.
Mm.
And not just the standards that we set, for preoperative, during the surgery, postoperative. If something goes wrong, because surgery there's no 100% guarantee that everything is going
Right.
to go great. You want to make sure that you're in a place where you have access to the best possible facilities and more importantly, access to your surgeon. Okay, so when you go outside the country, that's totally your prerogative, your choice. But you have to remember that when you come back to the US, you have an issue. It's typically very challenging to find a surgeon who's going to take care of, those complications or those issues. So those are some of
Mm.
the thoughts and sort of like the things you have to think about before you make that decision to go outside the country.
Oh, that's true. I didn't even, that's a good thing that you touched on is you go out the country, you're not happy. Or, God forbid you have an infection or something like that. And let's say you need I don't know, these are your terms, not mine. I'm just,
Mhm. Mhm.
help me here. But
Mhm.
let's say
Right.
they go get a breast lift or something like that, and
Mhm.
something is happening and they
Yeah.
have to take something out. So most surgeons here probably wouldn't want to touch that because they
Yeah.
don't really know what happened.
Yeah, yeah, because over here there's always this thing about liability and
Yeah.
practicing defensively, and so you're not privy to all that happened when they went outside the country,
Mm,
and so taking care of that patient, which is not necessarily a bad thing to do, but it might get you into an area that you know not much about, and so a
right.
lot of surgeons try to avoid that. However, if you had your surgery done here and your surgeon is located locally, you have access to that surgeon. For me, every patient I operate on has direct access to me 24/7. And I tell them
Wow.
you can call or text me at any point in time. I want to know first what's happening before
Mm,
anyone else. And sometimes it's something that you can just reassure them or you can just walk them through, and it saves them a whole lot of stress or worry. And so when you, like I said, go outside the country, you come back here, many times that communication
mm,
aspect is broken. And so you have to resort to other means, whether it's other patients who might have had completely different surgery than you had,
right.
or worst of all, the internet or Google or ChatGPT, and that can pull
Oh,
up a whole bunch of
ChatGPT
things
is
for
my
you.
friend, Dr. Stan.
Right,
ChatGPT is
right,
my
right.
friend.
Yeah, yeah, exactly. So there you go.
Okay. Oh wow. Okay. We're getting comments. I see some of your people in here, Dr. Stan. They're like
Hmm.
Dr. O is the best in the cosmetic surgery.
Oh my goodness.
Okay. They
Okay.
are going. Dr. Stanley makes people see how beautiful they really are. That is huge.
Yeah.
That is huge. I'm glad I have a cousin that's on the other things besides the wild side of IGL. People are talking. Okay. So I want to talk about BBLs because I
Hmm.
think that's just something that I'm seeing a lot of now, more of, I would
Yeah.
say.
Yeah.
And well, before I go to BBL, I want to talk about a mommy makeover.
Yeah. Yeah.
What is a mommy
A mother
makeover?
makeover, yeah. So a mother makeover is a colloquial term that encompasses several different kinds of surgery being done at the same time. But essentially, any procedure or group of procedures that tries to reverse the effects of being a mother. Okay, being a mother is a great, it's a beautiful thing, but it
Yes.
does a number on the bodies of most women. And the more kids that you have, the more, the more that those things stretch out. And
Yeah.
so, it could be a combination of work to the breast, the tummy, the butt,
Okay.
and the body in general that reverses the things that happen to a mother when she gets pregnant and has a baby. Okay, so it's a general term, but that could be, for example, doing a breast lift with a tummy tuck, a breast
Okay.
augmentation with a tummy tuck, liposuction circumferentially with a tummy tuck, and a BBL or breast lift. So it's a
So
general
whatever
term.
combo.
Whatever combination, yeah, of surgeries that are going to reverse the
Oh.
effects of being a mother. Yeah.
Okay. So we have, as you know, something called the FUPA.
Okay.
So I have
Yeah.
two, no, I have like three or four friends who
Okay.
were like, they're hard in the gym, Dr. Stan,
Yeah.
and they couldn't get
Yeah.
rid of that fupa. So they were like, I'm just gonna cut it off.
Yeah.
And they
Well.
stayed in the gym, but that's I think one of the reasons why they're like, hey, I'm eating right, I'm doing
Mhm.
everything, but
Yeah.
because of me having my children, I now cannot get rid of this fat and I no longer
Right.
want kids. I'm ready to live my best life, be on the beach in a two-piece. And then I guess they end up doing almost like a mommy makeover or
Mhm.
just kind of cutting through that fupa out a little bit.
Yeah, yeah. I will say that what you touched on now is very important. There's a lot of people who have, and for those who don't know what the fupa is, it's that area right over your pubic bone, and that right below your tummy. And for a lot of people, they don't understand that what they have there is not necessarily fat. That what you have there
Mm,
is just a bunch of loose skin that has sagged. And when you put on clothes or underwear or bikini or something, then it kind of just sticks up, and it's not very sightly, not very aesthetic. And so it's not something you can work out, get rid of by working out. You have to resort to some other means. And sometimes liposuction is enough. And sometimes you
okay.
actually need liposuction with skin excision, whether it's part of a tummy tuck or pubic lift or some other procedure that addresses that area. So a
Okay.
lot of women try really hard to fix that area by working out, like you said, but it's just not, just doesn't happen. It's kind of like having what we call a diastasis, which is the separation
Yes.
of the six pack muscle.
Yes.
There's no amount of working out that can bring that back together. Once it's happened, it's happened. It can
Yes.
only be surgically recreate it by bringing the muscles back together and what we call a muscle repair or diastasis repair. And
Yes.
so it's important sometimes to advise patients about this because they come in and they're like, yeah, I just want you to suck out the fat and I'm going to work out the muscle. And you have to explain to them that, that's never going to happen without
Yes.
surgery. Yeah.
I get a lot of that as a PT, right? I get a
Mhm.
lot where they come to me and they're like, "Oh, I had a baby. I have that status recti," and I'm like, yeah, I can
Yeah.
give you core exercises, but to be
Mhm.
honest, I
Yeah.
mean that separation once you feel
Yeah.
that two finger, like I'm sorry, I
Yeah.
can't. I've had a couple of
Absolutely.
patients be like, well, you don't know what you're doing. You're not a real PT. I'm like, I promise you, any PT that says they can go in and
Mhm.
literally use exercises to bring it back together,
Yeah,
I don't
no,
know.
no, no. I mean, what the studies have actually shown is that what you did prior to getting pregnant is the most
Mhm.
important thing
Yes,
that can help salvage those muscles. So
yes,
if you were working out a lot, those
yes,
muscles were toned, then there's a bit of a slightly higher chance that they could snap back. But if you were, couch potato, not working out,
right,
things like that, then afterwards you want to work it back together, that's never going to happen, unfortunately. So that's where we come in, take care of
right.
it. Yeah.
Absolutely, absolutely. I'm part of this Facebook group called Houston Black Doctors. This was when I was still stalking you, Dr. Stan.
Oh,
And I was going through the chat and someone was like, Dr. Stan, I took a screenshot so I can send it to you so that you don't know
good.
you don't think I'm lying.
Okay. I
I
hope I
saw
hope
a
good
screen
things.
and I took a screenshot and it said, Dr. Stan fixed my diastasis recti. And like so many women was like, oh my God, surgeons can
Mhm.
do that. They can do that. And I was just like, let me screenshot it. So I'm going to send it to you after this live
Okay, I'd
because your
love to
name
get
has
that.
been everywhere.
Oh, thank you. Thank you. We just try to, take care of one patient at a time. And, I've been doing this for a long time. So I'm
Yeah.
glad to hear that.
And it shows a lot of people in the comments are talking about your bedside manners, which is really important.
Yeah.
Someone just said, tweet by Bree said, Dr. Stan did my mommy makeover and I have no complaints. His bedside manner is unmatched. I just
Thank you.
recently had a baby and everyone tells me that I still look great. 10 out of 10 would recommend. I am yet,
Oh,
like, seriously,
okay, that's
everyone
awesome.
just
That's awesome.
loves your work.
I appreciate that. I'll keep trying to get better and better. That's the goal.
Hey, and I
Never
feel
stop learning.
like
Yeah.
that's the goal. You saying that and just, you can never be perfect. But I don't know, from these comments here, you're getting pretty I can't even get to questions because people are just talking. Please drop your questions in here so that your general questions, so Dr. Stan can kind of answer them. Just generally what to expect. Again, as a PT, I'm also a CLT, certified lymphedema therapist.
Hmm.
So I do see some patients post up with swelling and things
Yeah.
like that.
Yeah.
After the BBLs or the mommy makeovers, whatever surgery they may have, is there a referral process? Because from your table to the
Hmm.
club, or let's not even say to the club, from your table to their
That's like a
dining
pro.
table looking
Yeah.
good,
Yeah.
what
Yeah.
is the
So.
process?
Yeah, so definitely not the club right away. I would say that we actually encourage you to avoid alcohol as much as possible or take in very little moderation afterwards because you can swell a lot with alcohol and foods that are high in salt content. So you have to make sure that you're being very moderate with that. But for me, I have a protocol that I give all of my patients, depending on what surgery that they're having. And I was actually one of the first surgeons who was very aggressive with recommending lymphatic massage after any kind of liposuction or mommy makeover procedure. And that's because at the time, I'll say this was probably 7, 8 years ago, it was more prevalent in Latin America and it hadn't really permeated into, our plastic surgery community here. And so you would have some women who had were trained by Colombians, a Colombian therapist, and they were like, oh, you should look at this, so I had some patients who had gone to them and I saw how quickly their swelling was going on, how old they were looking. And so I actually went to Colombia. I went to Colombia to train under a doctor called Alfred Hoyos. And I just pretty much looked at what he was doing and I kind of copied it and I started applying to my patients. And now it's like mainstream. Everyone is doing it, which is
Yep.
great because you want
Yeah.
everyone to. So for my patients, I have a very, very rigorous postoperative protocol. And the moment you put your deposit down to book the surgery, you get a packet that contains everything because we want you to start understanding what, it's not just getting on the table, getting surgery and,
Right.
to the club or to the, no, there's actually a lot of things that have to happen before the surgery and after the surgery to make sure that you get the best results possible. Because no matter how good the surgeon is, he can only do so much. If
Right.
you're not very compliant with the post-operative protocol, your results may not turn out as well as the next person. And so you
Mm.
don't just compare yourself, oh, well, this person looks like me, see how good they look well, where you getting massages, where you're compressing, where
Yes. Yes.
avoiding stuff you should avoid.
Right.
Like I said at the beginning, long term, when you get your final results within 3 to 6 months, then the ball is now in your court and how you maintain that. And that's also very important.
Oh, okay. So I'm telling you, Dr. Stan, it's a
Yeah.
lot. I wish I brought my
Mhm.
pen and paper because I got a lot of questions. Let me
Oh,
get
please,
to
go for it.
P.A.MD. She said, I may have missed it, but what BMI is best to have for a mommy makeover? What if
Okay.
your BMI is higher because of muscle as elsewhere?
Yeah.
Good question.
Well, that's a great question. And I'll be the first to say that my philosophy has evolved a little bit when it comes to the BMI. When I first started practice, you're still trying to figure things out and figure out your patient population. I had a very strict BMI limit. I would say 34, nothing more than that. And then I'll have patients who came to me. And I have to say about 70% of my patients are Black women, African American women. And one thing I found out was that my patient population, they tended to have a higher BMI than,
Mhm.
than the average, than the general population. But I started looking into it and saying that, are these women who are, 35, 36, are they any less healthy than
Mhm.
those who are 33 and 34? And that became the yardstick. It was no longer so much strictly 34, but you could be a 35 or 36, but you're, very healthy, you're working out, you're doing all the right things, and there was no reason why you could not have surgery except we're just looking at a number. And so when I started working on those patients and I was getting great results, I realized, okay, it's not just about a number, but you have to look at individual patients.
Right.
Having said that, for most of my procedures now, if your BMI is 40 and above, I would want you to, lose some weight because
Right.
I think ultimately there are studies and things that have shown that the higher your BMI, the higher the chances of complications. So you might be healthy enough to get through the surgery, but how are you going to heal from the surgery? So I want to maximize the
Mhm.
opportunity for you to get the best results and minimize your complications and that you heal as well as possible. But like I said, my limit when I started practice has changed from what it was prior to what it is now.
And that just shows how thorough you are, right? Because not everyone, I guess what we read in school, what the protocol could be, is different than seeing someone in front of you. There's
Yeah,
so many different, I guess, things that attribute as to why you kind of moved up from whatever number to this number.
right, right. And don't get me wrong, BMI is not it's not a terrible metric, right? But
Right.
you have to look at how they came up with it. And the
Mm.
majority of the subjects in the studies that we used to calculate BMI were Caucasian males, not even
Oh,
females.
not even females.
Not even females, and a majority, not all of them, majority.
Mhm.
However, females tend to have slightly higher BMI, and African American females or Black females tend to have an even higher BMI.
Right.
But with every other metric you can look at, they're about as healthy. So it doesn't mean that as a surgeon you should just willy-nilly to anyone who comes in or whatever BMI, but you
Mhm.
have to look at your population and determine what's best for them, and you can serve them that way.
Awesome. Thank you for that.
Yeah.
Someone sent a private question and said, I did a tummy tuck about 2 years ago and still have some swelling. Is that okay? Is that normal?
Yeah. So back to your initial disclaimer, it's
Hmm.
not possible for me to say exactly what that may be, but I can tell you that I don't have any patients who had tummy tuck 2 years ago who are still dealing with swelling. So very likely it's not swelling that you have, and it needs to be you need to go back to your surgeon and have them evaluate you, examine you, and see exactly what that may be. But more than likely it's not swelling.
Thank you for that.
Yeah.
That's, you got to go back. We're referring you back. say, Dr. Stan, refer me back to you. And if I were you, I'll go see Dr. Stan because looking at all this,
Yeah.
yeah, I would definitely go see him.
Yeah, yeah. I mean,
Someone,
I do a lot of revision surgeries. You know,
okay.
they're not the most fun, but they can be challenging. And it's not every revision patient that comes through your doors that you're gonna accept. There's sometimes look at them and tell them, you know, for what you want and for what you're currently at, I don't think I can get you there. And you know, it takes a lot of thoughtfulness and humility to say that, but sometimes that's the answer that you have to give.
And I think for you to even give that kind of answer, that means, it's not safe for the patient.
Yeah,
And
sometimes it's about safety and sometimes about expectations. You know, you have to, yeah.
mm,
So, you know, I've evolved to the point where when I'm talking to the patient, I'm not just, you know, they're not just assessing if I can be the surgeon, I'm assessing if they can be my patient
wow.
because, you know, it's like we're evaluating each other. And sometimes
Yeah.
it's not the right patient for you because certain things that you believe in or certain ways that you do things may not actually, you know, appeal to them, and that's okay.
So it's a relationship. You both have to be on the same page.
Absolutely,
It's
absolutely.
not one way. It's not just because you want to look like that. It's also you're now my responsibility. And I want to like now we have a connection because of what we're about to do.
Yeah,
Wow. Thank
absolutely.
you.
Yeah.
Someone said I've been trying to keep my A1C and blood sugar levels down, but I'm type 2 diabetic and I'm trying to reverse it so I can qualify without medication dependency. What does that mean by like medication dependency? What
So
is
I think what they're trying to say is they're trying to get to a point where they're no longer taking medications to control the diabetes, right? Well,
Mhm,
diabetes has been shown to be, you know, a chronic disease
mhm.
that generally, you know, you need medications sometimes lifelong to take care of. But one other thing that we have actually seen is that when patients lose weight, sometimes the diabetes comes under control. So if they were their BMI was like so high, they had bariatric surgery, they lost a bunch of weight. Eventually, they found they don't need the diabetic medications anymore. And we've also found out that sometimes when I've actually seen this now, this is not recommended, but I've seen this happen when patients get like liposuction, a lot of liposuction, and we suck out a lot of fat from them, and they heal, and then they maintain their results. They don't gain weight again. Gradually, their A1C drops. Their blood sugars are better controlled. I've seen that happen as well. Of course, we don't recommend liposuction as a treatment for diabetes. We'd never say
You're
that.
right.
I have to mention that that's something that I sometimes used to motivate patients that, hey, listen, look, cut your A1C, so try not to gain the weight again because it's going to start to creep up. However, when it comes to our preoperative testing for patients, I like to have the A1C less than 7. And the reason is
Okay.
because, yes, with better blood glucose control, you're less likely to have wound healing complications. And there's a lot of studies that have shown that. You know, so for me, that's also one strict criteria that I don't change.
Okay.
Yeah.
I didn't even think about it that way. Please don't go say Dr. Stan said I need to do
Oh,
lipo to
no.
drop my diabetes because he ain't said none of that.
No,
He
no,
ain't
it's
say
not.
that.
It's not recommended. It's just a
It's
side
not
effect
recommended.
that I've seen in some patients, but no. Yeah.
Okay. Have anyone who has a BBL ever came to have it removed from their buttocks?
Yes. Not patients I did a BBL with, but I've had
Dr. Stan
patients.
said they ain't my patient.
No, no, definitely not my patients. I've had, and I've actually seen more and more of that in the past year or two. So, you talked about BBL when we started, and then we kind of switched tack to
Mhm.
body makeovers. But I think BBLs got very, very popular in the last 10 years. And initially, there was a certain kind of aesthetic that women were looking for. So I tell people, anytime you want to ask, oh, what are women looking for this time? Just look at what the Kardashians are doing. So
Yeah.
when the Kardashians all had like massive BBLs, everyone was going in that direction.
Mhm.
And then at some point they were like, okay, we need to start getting smaller. And then we've seen like a shift. Now we still have patients who come in and they want to be as big as possible. You always have to counsel them that once you do this, it's a permanent procedure. In
Mhm.
general, you lose a certain percentage of the fat that is transferred. So do not fall in love with or hate your butt early on because it's going to take about 3 to 6 months to get to the point where it's stable. Now, beyond that point, it's going to change with your weight. Your weight goes up, the butt gets bigger, the hips. Your weight goes down, the reverse happens. Anytime your body is trying to deposit fat, it starts with the areas where you have more fat. And anytime it's trying
Mhm.
to get rid of fat, it starts with the areas that you have more fat. So that's what happens. And
Mhm.
so, like I said, we started seeing, people who were kind of trending in the same direction with the Kardashians. Oh, I want a smaller butt. What can I do to this, and all that. And then the GLP ones came into the market. So since the GLP ones came into the market, and people started just losing the weight, the butts and the hips started dropping as well.
Everything.
And so, yeah, exactly. So I'm not seeing as many requests as before the GLP ones came in for, oh, can you reduce my BBL? But there was that narrow window in between having big butts to getting smaller butts before the GLP ones came in. And now that GLP ones are here, people are just losing the weight naturally by using the GLP-1 drugs.
Wow. But
Yeah.
it's a cycle.
Yeah.
You're right. It's like now the Kardashians will kind of phase out, and then some other family's gonna
I
come, or
think
somebody
so.
else is gonna come. They're
Yeah.
gonna want big butts. It's like we're just gonna keep going like this.
I think so. I think there's actually studies that have shown that the ideal waist hip ratio has changed like every 20 years. If you look at the women in the 1920s versus the
Right?
1940s, it was like they just kept changing.
True.
At some point, it was having a big bust that was in,
Yeah.
and then it just started swinging back to the butt, and now we're going back up the other
We're
way
going
again.
back up. We just
So
the
it
good thing is
just
you do the butt, you do all of
yeah,
it, so you're just going
it
with the
just
wave.
it just tells you that human beings are never satisfied. They,
No,
they're one
no,
way, and they're like, oh, we don't like this anymore. We want to go back the other way. So
no.
it's a cycle, like you said. It's just gonna keep happening. So we as the surgeons just have to know how to safely deliver what patients
Hmm.
are looking for. Yeah,
Right, and just be able to go with the flow.
that's right.
Okay. I'm going to rephrase this question a little bit. So it says, I had breast cancer and had my breast reconstructed, but they are really different. Can a surgeon, that's what I'm going to say, can a surgeon go back in to revise that surgery?
So the answer to that is possibly, but
Okay.
without seeing exactly what's going on and all of that, it's not really possible to tell. But I do know that, I've had patients who had previous breast reconstruction. It also depends on the kind of breast reconstruction you had. Sometimes it's done with implants, sometimes without implants, done with your own tissue. So the number of things you have to look at to make that determination are numerous, right? Sometimes all you need is some fat transfer, and sometimes you need a whole lot of work. And there's some patients like that I cannot help them. I have them either go back to their reconstructive surgeon or go to someone who's very, very subspecialized in what they're looking for. But there's some of them that I can actually help, and I've done that in the past.
Okay.
Yeah.
Thank you. Good question. Thank you for that. I think this is also my question because I think Shegun Gele talked a little bit about this in his last live. What's the
Okay.
difference between tummy tuck and a lipo 360?
Okay, so those are different procedures and they
Okay.
achieve different things, but they're very commonly done together. And the reason is that, like I said, they're different things. A tummy tuck is a surgery that gets rid of excess skin that is hanging, usually after a woman has had a baby, and stretches out the skin and also stretches out the muscle. And that muscle has lost its ability to recall, or what we call snapback. And so we have to go in and attach the muscles together. What's what is called diastasis repair, and we have to get rid of that excess skin. And most times we have to recreate the belly button to make it look more aesthetic. So that's a tummy tuck, in essence. Now, lipo 360 is just a term that is coined to describe circumferential trunk liposuction. Okay. Again, this was not always a thing. There was a time that we had surgeons, and actually, while I was training, it was very common to just do the tummy tuck and to liposuction, just the sides of the belly and nothing
Mhm.
else, the flanks. But when you do that, then you're not addressing, because it's very rare to see people who only accumulate fat just on one side of the body. Usually, if you're accumulating fat, it's something that affects you circumferentially on the trunk. So people started asking questions that why would you just liposuction just one area and then leave, the whole back looking,
Everything else. Right.
big. And so for most of my patients, 90% of my patients, they require circumferential trough liposuction, and that's
Mm-hmm.
lipo 360. So we think about 360 degrees
Mm-hmm.
liposuction. So in my practice, those are 7 areas that are all done together. So we have the upper abdomen, lower abdomen, the pubic area of fupa, like you talked about,
Right.
the flanks, and what is called the bra line. So when you put on your bra, the area that sticks above and below the bra on the sides, the upper back, and then the lower back right above the sacrum. So by doing that, I found out I've been able to get the patients the most narrow waist, which is what mostly what you're looking for most times, and the most curvy, which is what a lot of my patients want. Now, if they want to be
Mm-hmm.
more curvy, on top of that, they will recommend fat transfer to certain areas to add,
More volume.
to exactly more volume to the hips and to the butt, and also further change that waist to hip ratio, which is a thing that a lot of people are looking for. So that's what Lipo 360. So these are different procedures, but they're very
Right.
commonly done together
Together.
to achieve an aim of a complete aesthetic change of look.
Okay. Well, when you do my surgery, do everything. Do all that you can.
You
Don't
sound like an anesthesiologist. Every time we're working, she's like, "Oh, I want that too. I want
just
that."
just give me that. Look, I think my husband is on this live. So just give me
Okay,
all of
he's
that.
listening.
Whatever
He's
you know,
listening.
while you're in it, just do it. So I have
All
a
right, we'll
couple of
see. We'll
questions
see.
that
Yeah.
huh?
I said, we'll see. We'll see.
Look. Someone said, do BBLs have an odor? Some people are talking about that in there
Ah,
in the chat.
so here's the answer to that. Yes, BBLs have the same odor that you had before the surgery. It's the same odor that you had after the surgery.
Take me out,
So,
Dr. Stan.
so, so,
Take me out.
so the odor is not because you had a BBL. The odor is just an odor. Now, I will say, I've never had any patients who came in smelling one way before the surgery and smelled a different way. I will leave it at that. But the answer to that is yes, it's the same thing. No change. Yes.
Dr. Stan said, what? If you was a little funky before the surgery, you're going to be funky after the surgery. And
Well,
if you smell like roses before,
roses,
you going
yes.
to smell like roses.
And most of my patients smell like roses. That's what I will say.
All right. Oh, yeah. People are fighting for you. BBLs don't smell. Okay.
No, they don't. Absolutely. Yeah.
Kenny underscore the derm underscore MD, my cousin D. We know her. She was on our live,
Yes,
the
yes,
dermatologist.
yes. The
Um,
dermatologist. That's correct. Yeah.
yes. She said, I see a lot of patients with GLP-1s who unfortunately have horrible laxity. Have you had an increase in arm, legs, lifts, and tummy tucks with the popularity of these meds? Good question.
Yes, yeah, it's a good question. So I was doing a lot of skin excision prior to the GLP-1s, but now,
Mhm.
yes, I'm actually seeing not just an increase in people who previously might not have needed it, but also in people who've had previous surgery, but they went on the GLP-1s just to get some additional weight loss. And so they have come back for additional excision. Now, the GLP-1s have their benefits, and we know there's numerous benefits, health-wise, for everything from brain to the heart to kidneys, liver, everything. It's found that it's been useful. But I think one of the things that has to be talked about before people start them is the fact that you're very likely going to get some skin laxity with a
Mm.
certain degree of weight loss.
Okay.
If the weight loss is more gradual, then it maybe not as pronounced, but most times, you're dropping the weight very quickly with the GLP-1s. And so people have to be counseled on that so that they can, know what to expect, while taking the GLP-1s.
Oh, that's good. That's a good question because I know Serena Williams is really promoting that and talking about that now. So you're seeing a lot of that. And so, okay, thank you for that. So I have a question.
Yeah. Yeah.
I've asked a lot of questions and
Yeah.
thank you. So far, Dr. Stan, we've had the highest live members. So thank
Oh,
you.
that's
Yes,
good. That's
we hit a
good.
record tonight.
Yeah,
Thank you so
that's what
much.
we want. We want to be able to reach as many people and educate as many people as possible. That's great.
Absolutely, absolutely. So I'm hearing something about liquid BBL.
Mm.
So I asked my husband for a BBL. He was like,
Mm.
girl, if you don't go to the gym. So then I saw somebody else talk about a liquid
Mhm.
BBL. So I'm like, oh,
Yeah. Yeah. So a liquid BBL is it's a term. It's more of like a marketing term, but in reality, what's happened is instead of using your own fat to fill the areas where you need volume, which is called like a regular BBL.
Mm-hmm.
We're using certain kind of fillers, and those fillers can be sometimes temporary fillers that you need to re-up every year
Okay.
or so, or more permanent fillers that can be used. I don't want to get too technical, but the most commonly used one is called Sculptra. It's an amino acid that was initially developed to treat the indentations that we're seeing in patients who had HIV/AIDS, and they were on those
Okay.
medications, and those medications were causing them to have some wasting in certain areas, like their temple, their jaws, and things like that. So it was
Mm.
initially used in those patients, and they had like great results. And so people were like, well, if they can work in these areas, then they could probably work in other areas. And so we started using them. I will counsel on that though that you cannot use it usually to treat large areas because
Okay.
you're going to need so much of it, and the results
Mm.
tend to be marginal. And at the end of the day, you might end up spending more money than you'd have just spent on a traditional BBL. So
Mm.
money should not be the reason why you go with those, right? But the most important thing, besides everything I just said, is making sure that whoever is doing this is actually properly trained to do it. You know, look for a board certified, plastic surgeon or injector who's done a ton of this, and make sure that they're not using you to learn how to do it.
To
So
learn.
yeah. So that's what I would recommend. But again, like I said, it can get pretty expensive if you're trying to treat a very large area.
Okay. So I read somewhere, I think someone posted about it, and so I was kind of asking a little bit about it. Can it move because it's not
And what
really
move?
permanent?
Yeah. And what move?
Like can the like the liquid inside when it's
Oh,
injected, can it
no.
like
Yeah, no.
dislodge?
No, it cannot. So
Okay.
anytime you inject anything in any space, there's certain precautions that you're supposed to take until they mature. So you're supposed to treat them pretty much like eggs. When eggs are
Mm.
they're like fragile, and you don't want to like sit on them or lay on them. So those are some of the precautions that we give. So typically they don't move from one place to another if they're put in the right place, or
Okay.
if they're properly applied. And then after a certain time and of restrictions, then you can release the patients to sit and lay in any position that they want, and it should be fine.
Awesome. Thank you. For those following this page, please also follow the Health Hub with Dr. T page. That's the official page. We're getting to 1,000, so we can actually do a live on that page. So if you're following this page, please double up and follow the Health Hub with Dr. T.
Mhm.
Ooh, Dr. Stan, a lot of people are saying they're learning a lot. You're
Yeah.
dropping a lot of knowledge. I think that is the whole point of the Health Hub is to be a resource, a connection to a resource, and to be
Mhm.
knowledgeable before just going in and making any decisions.
Yeah.
Someone said, I was told if you did the liquid BBL, you can't have a BBL done afterwards. Is that true?
So that is absolutely not true. However, for some people, what they think a liquid BBL is silicone injection, and that is an absolute no-no. I've had a lot of people who've come to me to try to take out silicone that was injected. Silicone, especially industrial grade silicone, should never be placed in the human body, and those ones can actually migrate. And so when I have a patient who's had previous silicone, what they call butt shots, then we have to be very, very selective as to what we can do. And sometimes there's nothing you can do. You do a CAT scan and the silicone is kind of like all over the place, and it
Wow.
becomes more risky, more dangerous to try to go into the area to do anything. So that may be what they're referring to, but that's
Okay.
not even everyone who gets it. It's a certain subpopulation of them.
Wow. Ooh, I think we just look at it like, oh, someone went in, they're getting a BBL. Like, there's
Yeah,
all this behind
yeah.
that we're
And
not
that's why.
knowledgeable of.
Yeah, and that's why you have to make sure that you educate yourself
Yes.
and you do your own research for whoever it is that you're going to go to. I mean, if the first time that you're seeing the surgeon is on the day of the surgery, or it's been done in some kind of shady looking place or some kind of basement, I mean, that's like a clear sign you shouldn't be there, right? And sometimes, those are some of the things that you cannot really you can police when you go outside of the country. At least here in the United States, if you can find a dozen, 1,000 the places that look legit, as opposed to going abroad where you're not exactly sure what standards you're going to meet when you get to that clinic. Yeah.
Okay, thank you. Tinky's Diary. I'm gonna answer this one for Dr. Stan. Dr. Stan,
Oh,
please give me your
okay.
give me give me the okay. She said, "What are your prices, doc, for
Mhm.
BBL?" Dr. Stan is doing the work. I can tell you, he has a whole team ready to help
Mhm.
you
Yeah.
and give you as much information on prices. I
Mhm.
mean, I would just look him up on Google, call the
Yeah.
clinic, and say, I saw him on a live. He talked about he's the BBL king. Can I get the king's prices? And I'm
Well,
pretty sure his staff would be more than happy to help you.
so thank you for answering that. I will add that you don't even have to go as far as Google. If you go to my page, right at the top, my bio, number, email, address, everything is there. And to cap it off, I think it's like going to a store and saying, hey, or to a car dealership and say, hey, how much is a car? It's impossible to tell. They're gonna be like, what kind of car? So we have to figure out, your medical history, we have to evaluate you and say exactly what you're going to be needing. It's not a one size fits all. It's not a cookie cutter thing. There is a range, so when you call, they can give you that range, and you can decide if it's within your budget.
I want a Bentley.
Okay, we got Bentleys too.
Question says, I know you're the BBL king, LOL, but do you do reconstructive breast surgeries, status post mastectomy with tissue sparing? Also, do you do facelifts?
So great question. So the answer to both of those is no. So I haven't done reconstructive breast surgery in over 7 years. And the reason is because as I started practicing, I was pretty much open to doing any and everything. And I started kind of looking at what I was really good at, and I wanted to just focus on it. So all the training, the reading, the research, everything I do has been focused mostly on aesthetic cosmetic surgery of the breast, the body, the tummy, the back, the butt, things like that, right? I do my fair share of facial plastic surgery. So, but I don't do rhinoplasties. I don't do facelifts. I'll do the eyelids, I'll do the chin, the buccal fat pad, pretty much everything else. But those two, when I have a patient, my patient population was not really requesting for that. And so when I had few patients who requested for that, I'd refer them out to someone who I felt would do a better job.
Awesome. Thank you. You
Yeah.
guys, we have 2 minutes. All
Two
right. What
minutes.
time frame would you suggest when having a TT in another state? Would you recommend the person stay before going home to recover?
So great question. So I'll just put it in general. When I have patients coming to me from within Texas, and by that I mean, Dallas, Austin, San Antonio, I recommend they stay between 5 to 7 days. If they're coming from out of state but within the US, 7 to 10 days. If they're coming from outside the country, generally 10 to 14 days. So, I kind of leave it up to them a little bit because some patients recover a lot faster. They're ready to go back. But that's the general timelines that I give the patients.
Awesome. Thank you. Oh, Dr. Stan, I'm going to
Yeah.
ask you this on live
Yeah,
so
go
that I
ahead.
can be like, remember you said, can you come back to the Health Hub with Dr. T?
Hey, we did it once, and sure, we'll do it again. I think it's been great. It's been a
Yeah.
success,
It's been
and
awesome. Like so
uh,
many people are literally like, I
yeah,
promise you, I think the next time you come on, I need a moderator because I'm trying to moderate, ask my questions, ask their questions. So
yeah,
you're gonna have me invest in a moderator because
yeah, yeah.
this
But,
has really been
perhaps you can,
informative.
perhaps you can do it for an hour and a half next time. Maybe we'll give you a bit more time. Yeah,
Yes, hopefully we got to get to 1,000. So please post, go follow the
yeah.
Health Hub with Dr. T. Someone said for all your surgeries, use discount Dr. T for 1%. You get
Oh my
Dr. Stan.
goodness.
If they
I don't know if that's gonna work, but you could try.
You got to give them
Oh, 1%. Oh, I think we can do 1%.
1%. Use Dr. T as your discount code. Any Any last words, any last
Oh,
piece of information you would like to give to
yeah,
everyone?
yeah, absolutely. So I'll just say, just to recap everything, cosmetic surgery is an elective procedure. And so you have to make sure that you're in the best medical or health shape that you can before surgery. Make sure you do your research. Make sure you go to a board certified plastic surgeon. I'm a double board certified plastic surgeon. And make sure that you actually get everything that you need together before embark. Because it's not just a one day thing. You go on the table and then, you're going about your business. It's actually a process. It's a journey. You have to be mentally, physically, health wise prepared for that.
Thank you. Thank you so. I can't thank you enough, Dr. Stan. I got to thank
Yeah.
your wifey, Miss Uche. I got to thank Queen Lucci, your
Thank
sister,
you.
because they
Thank
made
you.
this connection happen. And I am
Yeah.
going to be in contact with you, Dr. Stan. I am. This
Thank
has
you.
been super informative. People are saying
Yeah.
they've learned a lot. I think as a Nigerian, plastic surgery gets a bad rap, but I have enjoyed this live and the amount of education, great
Yeah.
information. Thank you,
Yeah.
Dr. Stan. This has been so awesome. I can't thank
No
you
worries.
enough for sharing
No
your
worries.
knowledge. Your
No worries.
time, your time
Yeah.
is very valuable,
Yeah.
and you have, done that. And so I don't take it for granted. Thank you all
Thank
so
you.
much. Please follow the Health Up with Dr. T. Dr.
Okay.
Stan said he's coming back. So go
Yeah.
ahead and
I
follow
will.
so that you know when he comes back.
Yeah, yeah, absolutely. Yeah, so it's nice talking to all of y'all and best wishes. And thank you, Dr. T, for what you do. Okay.
Absolutely. Thank you. You guys have a blessed week and the rest of your evening.
All
Thank you,
right.
Dr. Stan.
You're welcome. Thank you. Bye
Bye.
bye.